Senator Miller.
Thank you, Mr. President. I move that further proceedings on the roll call be dispensed with and the Sergeant at Arms be instructed to bring in the absent members.
To that motion, all those in favor signify by saying aye. Those opposed, the motion does prevail. The Secretary will close the roll. Reverting to the fifth order of business, reports of committees. Senator Miller.
Thank you, Mr. President. I move that the committee reports printed in the addendum be adopted.
On that motion, all those in favor signify by saying aye. Those opposed, the motion does prevail. Moving to the sixth order of business, second reading of Senate bills. The Secretary will read the Senate file numbers.
Senate file number 3540.
The Senate file is given its second reading. Moving to the ninth order of business, motions and resolutions. Senator Miller.
Thank you, Mr. President. I move that the 12-hour requirement for Joint Rule 2.06 be suspended as it relates to the conference committee reports on Senate file number 3472.
To that motion, all those in favor signify by saying aye. Aye. Those opposed, the motion does prevail. Remaining under motions and resolutions, we will take up the conference committee report on Senate file 3472. Senator Dahms.
Well, thank you, Mr. President, and members. I move that the foregoing recommendations on Conference Committee Report 5 Concert Report on Senate File number 3472 be now adopted and that the bill be repassed as amended by the Conference Committee.
On that motion, all those in favor signify by... Senator Dahms to explain the bill.
Thank you, Mr. President. And what I'll do is just take a few minutes and talk about the changes that occurred to the bill since we passed it off the Senate floor. When we passed it off the Senate floor, we were asking for 5 years of reinsurance fully paid up front. We also stated that we wanted if there's a loss to the BHP, the basic health plan, due to the fact that we did not get the second part of the 1332 waiver, that money would be taken out of the general fund. There were some changes there. We ended up with 3 years of health insurance. The first 2 years are paid up front, and the third year is paid in the tails. So we have 3 years of paid up health insurance, or the health reinsurance. And then the way that we decided to handle the loss to the basic health plan, if there is one, due to the fact of the waiver maybe not being fully paid like it was last time, we agreed that we would take 50% of that out of the Healthcare Access Fund and 50% out of the general fund. So therefore, the first 3 years, we would pay the 1/2 of the 3-year BHP loss out of the general fund, 1/2 out of the Healthcare Access Fund. So in order to make that happen, as you may recall, we receive $122 million every year that's transferred from the Healthcare Access Fund to the general fund. So what we decided to do was to not have that transferred to the general fund, and we would take the 1/2 of the 3-year payment off of that, and then the balance would be sent to the general fund. So the original dollars for our share of the BHP loss would come out of that general fund through that transfer, and so that's how we're going to handle that. The other 2 things that were changed in the bill dealt with policy, and the first one is that we added on, and let me look at that here. We added on the, gotta find it here, the postnatal care, we added that on for the individual policies. And currently, a majority of the health plans are already doing that, but the request by the House was to have that placed in this policy, so we've included the postnatal care for the health plans on the individual market. The second thing that was added was the flattening of the out-of-pocket expenses and the co-pays for the prescription drugs in the policies. So how that's going to work is the copay and the out-of-pocket will be spread over a 12-month period. And so what will happen is the insurance carriers will be required to have a silver policy and a gold policy in each of the areas that they write in. And then after a 3-year period, if there's less than 75 people enrolled in that policy, then the insurance companies will have the right to cancel that policy. So this will exempt, if they have a policy that has the flattening of the copay, it will exempt the guaranteed renewability after 3 years. And so that would be the changes, members. So at this point, I'll ask, open it up for questions.
Questions to Senate File 3472 and comments? Senator Klein.
Well, thank you, Mr. President. Thank you, Senator Dahms. No questions for the author. Simply a few comments about the status of the conference committee report and the process. And first of all, let me thank Senator Dahms and the Senate conferees and Leader Lopez-Franzen, Leader Miller for working in earnest and with diligence late into the night last night to get this arranged in a shape where we can vote on it today. This bill, once passed today, really will hold down premiums for people in the individual market across Minnesota and shelter them from that significant economic bump to their situation as these rates come due in October, and that's a good thing. The two provisions surrounding policy that were brought forward by the House are good and will directly improve the lives of my patients, so I'm grateful for those as well. It's important to say, though, as we always do when this comes up, that this is not a solution to what ails us with health care in Minnesota. This is not anything more than what we knew it was 5 years ago when we first passed it, which is a financial instrument to correct a market instability. It does nothing to improve health care outcomes for patients. It doesn't make our care more compassionate. It doesn't lower copays or deductibles for people. It does not control drug prices, except in the setting of that one situation in the policies. And these are all things that Minnesotans are urgently asking us to accomplish. Once again, we have brought forward proposals over the years to try to solve those concerns. We've brought forward the public option. We've brought forward the Minnesota Health Plan. This year, understanding that our Republican colleagues are not receptive to those proposals, we brought forward proposal for tax credits to accomplish direct relief of premiums as well as copays and deductibles for Minnesotans. These are things that people are demanding, and we should work actively during the 3 years that we are paying for this reinsurance to accomplish those ends. There are alternate delivery and incentive models out there, such as value-based care, and I hope we spend our time diligently looking at those as well. I will be voting for the bill today because it's the right thing to do for copays and deductibles. It's the right thing to do for premiums for Minnesotans. It is not a solution, and we can do much better. Thank you, members.
Senator Wicken, did you want to wait for third reading or speak now? Further discussion before third reading? Senator Dahms renews his motion to adopt the conference committee report on Senate File 3472. All those in favor signify by saying aye. Aye. Those who are opposed? The motion does prevail. The Secretary will give the bill its third reading.
Senate File Number 3472, a bill for an act relating to state government extending the operation of the Minnesota Premium Security Plan.
Third reading. Senator Wickland.
Thank you, Mr. President. I just wanted to make a few comments. I was disappointed with the bill that we passed off the floor and was hopeful that when the bill or when this conference committee report came back to us that it would contain more emphasis on looking forward instead of just looking at extending what we had been doing, which we know is very costly and frankly not efficient. But the solution that has come back to us, while we don't have an opportunity to change it any further, I just want to say that it does commit a very significant amount of money, $700 million, to go to insurers. And it is not doing everything that we should be doing to make sure we're protecting our basic health plan, Minnesota Care. It allocates, as Senator Dahms mentioned, the $173 million will be provided to cover the smaller amount of federal funding that we would receive, we think. But that is really accounting for about half of what will not come to us from the federal government. So the report does not also, it doesn't require us to make any changes if we aren't assured by the federal government that this federal money will be passed through to us. And so we're really, I think, making steps forward that support the insurers, but not taking the steps we need to make sure that our basic health plan, Minnesota Care, is financially stable, that we have the assurance that it will be financially stable going into the future. I think that the two policy provisions that were added, having to do with prenatal care and prescription drug or copays, are good and somewhat helpful, but they don't address the rising cost of health care for Minnesotans. They aren't bringing down health care costs. And we know that plans that people are buying on the individual market, while their premiums are held to be lower because we have reinsurance, they are still not affordable for people when you take into account all of the copay or the deductibles and out-of-pocket costs. So we had an opportunity here to bring forward policy provisions that the House carried in their bill, such as creating a board or commission to maybe help hold down healthcare costs. There was a policy provision about holding our system accountable for enforcing mental health parity, and that would have been a good provision to bring forward so that we have some accountability for making sure mental health parity happens. Also, just a study of healthcare, an option to implement a public option, a study to do that could have been brought forward, but we don't see any of those in this report, and it's disappointing because we do need to be looking at other ways to help all Minnesotans with healthcare costs and reducing costs. And we have more opportunities that we could have taken advantage of. So I will still be no vote on this, and I hope that we continue to have discussions about ways to improve health care and access to quality health care for Minnesotans in the future. Thank you.
Senator Nelson.
Thank you, Mr. President. Well, I stand in support of Senate File 3472. Members, this bill is needed to help prevent the double-digit spikes in insurance premiums for far too many Minnesotans following the nationalized health care. This is critical that we help hold down these premiums. Minnesota did this several years ago with reinsurance, and it became a national model. Our state has long been a national leader in health care. It's essential that Minnesotans continue to have access to that at an affordable cost. I am pleased to see that we have Senate File 3472 in front of us to continue that highly successful reinsurance program. I also want to stand and commend the conference committee and Senator Dahms for adding a provision that is very important to me. It is the flat, predictable copays. This is something that I've been working on for about 3 or 4 years. I'll just give you a brief story about that. My friend Cheryl stopped me at church one day and told me about her high cost, her prescription drug, $6,000 a month, members, $6,000 a month. And it made all the difference for her being able to live her normal life. $6,000 a month. And I went home and started thinking about that and looked for ways, why did she have to upfront that cost every month? $6,000 a month until her deductible was paid and then she didn't have to pay anymore. That was a tough thing. Sometimes that's the difference between a house payment or paying rent. And so I am very glad to see that Minnesota now will be adopting the flat, predictable copay. It will allow Minnesotans to better afford those highly effective but often very costly prescription drugs.
Senator Marty.
Thank you, Mr. President. I think Senator Nelson pointed to what a problem we've got here when one of her constituents is worried about $6,000 a month co-payments on prescription drugs. And I guess I'll say that I understand why people support this, because if we put enough money into it, we can buy down the cost of these insurance premiums that don't give people health care. They give them a chance to maybe get coverage if they can afford their co-pays and deductibles. Just a disappointment, though, that we continue trying to tinker with a system that is so sorely lacking. We got some of the best medical professionals in the world in this state. Got a health care system where half the people in the state don't go to get the care they need because they can't afford it. And this bill is an attempt to patch the system. It's a broken system, and I hope we realize that when we spend $70 million a year in state money and so much more in loss of federal funds to BHP, when we keep doing that year after year and we don't fix it, that maybe we ought to recognize we're on a bad path and we ought to turn it around and make sure we stop talking about affordability of the health insurance market and just give people health care. It's not a difficult idea. It's something our constituents deserve.
To the author of the bill, Senator Dahms.
Well, thank you, Mr. President. And first, I want to thank some people that had an awful lot to do with making this happen. Our researcher, Jonathan, for the Department of Commerce, or for the Commerce Committee, he does our research, and Owen, our committee administrator, and Lauren, our committee legislative assistant. I want to thank those three. They've put in many, many long days and hours this last week to make this happen, so I want to thank them personally and publicly. Next, I'd like to thank the members of the Conference Committee, Senator Utke, Senator Dornick, Senator Draheim, and Senator Klein. Certainly do appreciate their being on the Conference Committee and their input. And members, I know there's still some consternation about the bill. I understand that, but as at this point, it's probably the best we have, and so I'm very happy to move this bill forward and to help protect probably somewhere in the neighborhood of 180,000 folks. So thank you, members.
Senator Lopez Franzen.
Thank you, Mr. President, and Senator Dahms and the conferees and everybody involved in making this bill come to the floor today. Members, this is what compromise looks like. It's not a solution, though, but a fake fix to increasing healthcare costs, as my colleagues have mentioned, that we have all experienced in our premium increases over the years. I just recently talked to my parents, and my mother's about to retire, and she was trying to budget for the increase in Medicare. This is a reality of many Minnesotans that continue to see high costs in prescription drugs, high costs in health care, high costs in the emergency room, which, quite frankly, many Minnesotans rely for their only care, and it's the most expensive care. I have never been a fan of reinsurance. I'm not a fan of it today. The cost is too high, and it's a fake fix to a problem that we know we have to bring new and innovative solutions. Members, we can do better. Healthcare is a basic human right, yet the most powerful nation continues to pass on taking the next steps to provide true access. This bill did not include a study, which Senator Wickland mentions, that would have provided further ideas for our bodies to talk and discuss about cost containment and healthcare delivery, but it was blocked by the majority. It did also not include mental health parity. This provision was $500,000, members, something for the Department of Commerce to do to help insurance providers to be able to make sure that we have healthcare, mental health parity in our state. Yet it was blocked by the majority. There is simply no interest in real fixes, and although I'm disappointed, members, I am not surprised. I'm not surprised, and I know that Democrats will continue to fight for health care for all, and we're going to take that message to the people. Members, I know we have to take care of high rises in costs for health care. We're seeing our constituents grapple with inflation, yet we have $700 million for the insurance companies at a time where we can't even agree with $250 million on frontline workers from last year. I know that this seems to be an emerging issue for tomorrow, for our deadline, but the deadline for frontline workers has come and gone, and we have not acted with urgency. So members, again, I encourage you to really think deeply about your vote. I know that we want to make sure that our constituents know that we're there to help them with their costs, but this is not the long-term solution I would expect they would want from us. Thank you, Mr. President. Thank you, Senator Miller, for helping us move to this deadline, but I hope we can do better, and we still have time to do that in the next few weeks of session. Thank you.
Senator Miller.
Thank you, Mr. President. Members, this bill is the result of Democrats and Republicans in the House and the Senate working together toward a compromise, working together with the governor and the administration towards a compromise. Republicans didn't get everything they wanted. Democrats didn't get everything they wanted, but it's a compromise. And what this bill does, what reinsurance does, is it helps stabilize the individual health insurance market. It helps keep costs down, and it provides access for Minnesotans. Members, what this compromise is this is a win for the people of Minnesota, and that's the most important thing we can deliver today. I want to thank everyone who was involved, all the conferees, Senator Dahms, Senator Klein, Senator Dornick, Draheim, Utke, the House members, the administration, everyone who was involved in this process to get us to this point today. It was a lot of hard work. It took a little bit longer than I was hoping, and I think many others were hoping, but we got the job done. Nice work, everyone. Thank you for all of your good work, and looking forward to passing this bill for the people of Minnesota.
The Secretary will take the roll on final passage of the Conference Committee report on Senate File 3472. I call on Senator Friends to report members voting under Rule 40.7. Senator Friends.
Thank you very much, Mr. President. I report Senator Champion votes no.
Champion votes no. Senator Friends.
I report Senator Eaton votes no.
Eaton votes no. Senator Friends.
I report Senator Fateh votes no.
Fateh votes no. Senator Friends.
I report Senator Latz votes no.
Latz votes no. Senator Friends.
I report Senator Port votes no.
Port votes no. Senator Friends.
I report Senator Rest votes aye.
Rest votes aye. Senator. I call on Senator Johnson to report members voting under Rule 40.7. Senator Johnson.
Thank you, Mr. President. Senator Bach votes aye.
Bach votes aye. Senator Johnson.
Senator Duckworth votes aye.
Duckworth votes aye. Senator Johnson.
Senator Gazelka votes aye.
Gazelka votes aye. Senator Johnson.
Senator Goggin votes aye.
Goggin votes aye. Senator Johnson.
Senator Housley votes aye.
Housley votes aye. Senator Johnson.
Senator Ingebrigtsen votes aye.
Ingebrigtsen votes aye. Senator Johnson.
Senator Jasinski votes aye.
Jasinski votes aye. Senator Johnson.
Senator Rude votes aye.
Senator Rude votes aye. Senator Johnson.
Senator Thomasoni votes aye.
Thomasoni votes aye.
Oh.
Senator Johnson.
And Senator Newman votes aye.
Senator Newman votes aye. All members having voted, the Secretary will close the roll. There being 47 ayes and 20 nays, Senate File 3472 as part of the Conference Committee report does pass in its title agreed to. Moving to the 13th order of business, announcements of Senate interest. Without objection, the following senators will be excused from today's session. Senator Champion, 11 o'clock until 1:15 p.m. Senator Limmer from 12:15 to 12:25 p.m. Additional announcements. Senator Miller.
Thank you, Mr. President. I move that the Senate do now adjourn until Monday, April 4th at 11 a.m.
On that motion, all those in favor signify by saying aye. Those opposed? The motion has prevailed. Senate is adjourned.